In today's show, Greening the Heart, a plant-based prescription for angina relief, we will delve into the causes of angina or chest pain and explore how adopting a vegan diet can not only reverse its typical cause, coronary heart disease, but also serve as a preventive measure for it. If you experience angina, take heart, for you are not unique. Approximately 10 million individuals in the United States alone grapple with the challenges of angina. To maintain a resilient heart, a potential antidote lies with plant-based nutrition. Before we explore the solution, let's gain an understanding of what angina is. Angina signals the heart's need for increased oxygen and blood flow. Whether triggered by physical exertion or emotionally intense situations, angina prompts us to pause and listen. Angina pectoris is the formal medical name for angina, which refers to chest pain. According to the American Heart Association, angina usually causes uncomfortable pressure, fullness, squeezing or pain in the center of the chest. You may also feel discomfort in your neck, jaw, shoulder, back or arm. While angina is generally associated with reduced blood flow to the heart muscle, the specific cause can vary among its different presentations. There are 4 distinct types of angina, each with specific characteristics. For example, stable angina is often triggered by stress, exercise, or exposure to cold weather, serving as a potential indicative signal of underlying coronary heart disease. Typically attributed to atherosclerosis, this condition results from the gradual accumulation of plaque composed of cholesterol and fats, which are abundant in animal people meat and dairy sources, on the inner walls of coronary arteries. Consequently, this process leads to arterial narrowing and diminished blood flow to the heart. During instances when the heart requires additional oxygen, the constricted arteries caused by coronary heart disease restrict the supply of oxygen-rich blood to the vital organ. Symptoms include discomfort or pain within the chest region for a few minutes, nausea, shortness of breath, and pain radiating to your left shoulder or down your left arm. Relief is attainable through rest or appropriate medication. Unstable angina is related to atherosclerosis. It results from the rupture of a plaque in a coronary artery, leading to the formation of a blood clot that partially or completely blocks blood flow. Although the blockage can be temporary, unstable angina is more dangerous because it increases the risk of a heart attack. Unlike stable angina, the symptoms of unstable angina may occur even at rest and are more severe. Unstable angina is marked by tight or crushing chest pain, shortness of breath, sweating, anxiety, and dizziness. Unstable angina is a medical emergency, and prompt intervention can help prevent a heart attack and its potentially severe consequences. Microvascular and prince-metal angina, the other 2 forms of the condition, are not primarily linked to poor diet. Microvascular angina involves dysfunction in smaller blood vessels that lessen the amount of blood reaching the heart, and prince-metal angina is associated with spasms in the coronary arteries due to smoking, certain drugs, stress, or cold. Individuals experiencing symptoms of angina, regardless of its classification, are strongly advised to seek consultation with healthcare professionals for a precise diagnosis and proper management. Proactive measures play a crucial role in mitigating the impact of the condition. Fortunately, for both stable and unstable angina, there are strategies for management and prevention. Among these, lifestyle modifications, including smart dietary choices, have proven to be particularly effective. Taking these measures not only help in controlling symptoms, but also contribute to the overall well-being of individuals experiencing the condition. The most effective way to initiate positive changes is through dietary modifications. The primary recommendation is to embrace a heart-healthy, plant-powered eating approach. A review article titled Plant-Based Diet and Its Effect on Cardiovascular Disease, published in the International Journal of Environmental Research and Public Health, analyzed several studies regarding the benefits of adopting plant-based eating. One of the authors' conclusions was, based on these studies, a vegetarian or vegan diet has been associated with improvements in cardiovascular and all-cause mortality. A paper published in the Journal of Geriatric Cardiology discusses the prevalence of atherosclerosis and states, atherosclerosis and its related cardiovascular disease is the most common cause of morbidity and mortality in the Western world. The article presents a case study of a 77-year-old woman with unstable angina. Despite severe three-vessel disease and a recommendation for coronary artery bypass graft surgery or CABG, the patient chose to adopt a whole food vegan diet instead. Within a month, her symptoms nearly resolved and she experienced improved cardiovascular health markers. However, she reverted to her previous diet that included animal people products after 4 to 5 months. Consequently, her symptoms returned, leading to eventual CABG surgery and coronary stent placement a year later. An animal people meat-based diet is associated with the release of small proteins known as pro-inflammatory cytokines. These proteins serve as communication signals between cells, primarily for immune responses. Unfortunately, they have a tendency to promote dysfunction in blood vessels and speed up the progression of atherosclerosis. The case underscores how a whole food vegan diet can rapidly improve anginal symptoms and contribute to the improvement of the atherosclerotic disease process. The patient's relapse upon returning to a conventional Western diet highlights the impact of lifestyle choices on cardiovascular health despite consistent medication. Was the woman's temporary recovery just a stroke of luck, or is there more to the story? A 60-year-old man who experienced angina took a different path and said no to medications and invasive procedures, opting for a whole food vegan diet. His experience echoes the previous case, with marked improvement in his condition and a notable drop in blood pressure. The authors of a case report on the gentleman highlighted the positive impact of the whole food plant-based diet, stating that it betters plasma lipids, aids in managing glycemia in type 2 diabetes sufferers, and can profoundly improve coronary artery disease, among other health benefits. These revelations strongly support use of a dietary approach as a primary recommendation for patients dealing with atherosclerosis, a risk factor for angina. In an article on the nutritionfacts.org website titled The Best Diet for Chest Pain, renowned American physician Dr. Michael Greger, vegan, discusses the Dr. Dean Ornish program, which has been scientifically proven to reverse coronary heart disease without medication or surgery. The program demonstrated a 91% reduction in angina attacks, primarily attributed to the adoption of a plant-based diet complemented by moderate exercise and relaxation techniques to manage stress. Notably, a separate study conducted without changes to lifestyle placed angina patients on a plant-based diet alone, resulting in the same 91% reduction in angina within 24 days. The scientific rationale behind the cardiovascular benefits of a vegan diet, specifically in regards to alleviating angina symptoms, is rooted in the avoidance of animal people meat consumption, a primary source of cholesterol. Extensive scientific evidence points to the link between plant-based diets and enhanced arterial function, suggesting that reducing cholesterol levels is correlated with improved endothelial function and subsequent enhancements in blood flow to the heart. Dr. Greger references in the article a study that experimented with diverse methods of cholesterol reduction, including cholesterol-lowering drugs, a low-fat diet, and even a diet of enriched sugar water for 90 days. The findings revealed that lowering cholesterol increased blood flow and reduced angina attacks. Dr. Greger believes the investigation highlights the efficacy of dietary strategies, particularly a very low-fat diet, such as the Dr. Dean Ornish diet, as an effective alternative for managing angina. Unlike animal-based products, including dairy, which are predominantly high in cholesterol, plant-based sources are naturally low in fat and devoid of cholesterol that contributes to arterial narrowing. Instead, plants contain compounds that actively promote smooth blood flow. The findings prompt critical thinking about the traditional reliance on anti-angina pharmaceutical solutions and costly surgeries, and highlight the benefits of dietary interventions as a low-cost tool. Embracing the vibrant world of plant-based nutrition isn't just a culinary adventure, it's a direct route to a heart-healthy lifestyle. Why not seize the benefits, sidestep the challenges, and let the plant-powered route lead you to a heart that beats with happiness and health? Affable viewers, it has been a pleasure to have you with us for Winning the Heart, a plant-based prescription for angina relief.